We have 3 children's homes across the state of Louisiana.
Sarah Head is the Director of Development for Louisiana United Methodist Children and Family Services. The group runs 3 homes for children with behavioral health issues. On June 24th, the newest home in Loranger in Tangipahoa Parish opened its doors. The state-of-the-art facility was a giant step forward in a journey that began in 2005 when Hurricane Katrina forced the Methodist Home for Children of New Orleans to close. It had first opened in 1886.
Our headquarters is in Ruston, Louisiana, so North Louisiana. We have our Methodist Children's Home of Southwest, which is in Sulphur, right outside of Lake Charles. And then we have this new facility in Loranger, which operates as our Southeast hub.
The Ruston home first opened in Bunkie in 1902 and moved to Ruston 2 years later. It all adds up to more than 135 years since the homes opened their doors to orphans, and in the years following, the facilities and the services have grown.
In addition to these 3 residential care facilities, we operate a variety of community-based services throughout the state that help build out the levels of care that we're able to provide. So this includes therapeutic foster care, family counseling, life skills training for children that are aging out into independent living, equine therapy, etc.
Marlene Giacona is director of the brand new facility in Loranger.
We are providing very intensive services to a population of children that are severely struggling to maintain some semblance of normalcy in community-based. In essence, anyone can refer a child to our program, but there has to be basically a ladder leading up to the need for this intensity in terms of intervention. So they have had, the support system has to show that every community-based services has not been successful.
In a fully functioning system where, you had all levels of care, you had community-based, you had the necessary level of psychologists and psychiatrists and pediatricians in every parish of the state, even with that functioning system, there's still a place for this type of care. And because we are missing so many of the community-based levels in our state, what we provide is even more important.
The location of this newest home in Tangipahoa Parish was very strategic.
We wanted to be in a central location that we were close enough to the greater New Orleans area, and then also closer to the Baton Rouge area. Because if you look at the population of the state, we are right smack in the middle of the most populous area of our state. And we wanted to make sure that we are providing those much needed services into the communities that maybe otherwise wouldn't have a resource to kind of tap into.
The equine therapy mentioned is fascinating. The Southeast home will eventually feature the therapy, which is prevalent in the North Louisiana home. Big, imposing, and yet friendly, horses play a unique and powerful role for these children.
Why is that so important? Why is the equine therapy so important?
I think our CEO says it best, where he says there's nothing like seeing the relationship that a child can form with the horse. So if you think of a horse, you think of this pretty significant animal, and then you think of children being able to approach this horse and gain that horse's trust. And it's really about teaching a child that even though the initial work of establishing a relationship, a healthy relationship, takes time. The possibility of establishing that healthy relationship and gaining trust, not only that horse trusting the child, but also the child trusting the horse. It's a vital aspect of teaching children and reinforcing children that positive relationships are possible.
These gentle giants are quietly helping children rebuild and restore trust that will carry over into their interactions with their parents, their family, and people around them. It's an especially vital aspect of care in a world where the mental health crisis is severe.
Currently, we have what's known as our OWL Center, our Outdoor Wilderness Learning Center outside of Ruston in Duboc, Louisiana. And so right now, that is our primary equine therapy center. And we kind of base it from there. But what's great about our new Southeast Louisiana location is that it is on 126 acres. So we have a ton of space where we're able to grow and build out.
We're all about planting positive seeds so that in turn, our children and families can take those positive seeds and then transplant them into their home community. So it's really about breaking the cycle of out-of-home placements. It's addressing the cycle of trauma and abuse that is unfortunately so prevalent in our communities.